what happens when, let's say you have back pain and you get an MRI and it shows that you have a degenerative disc disease, or you have knee pain and you get an MRI and it shows that you have a tear in your meniscus. We have to be careful not to take that information and link those two things together as absolute unless we have additional information to suggest that those are linked. So as an example, we'll go with the meniscus. If a patient comes in and let's say they have pain on the outside of their knee and physical exam testing doesn't really show that the meniscus is a problem, so we're not getting any of our orthopedic tests that are saying meniscus is an issue, and the patient also does not report any mechanical symptoms in the knee, meaning the knee catches, it locks, has clicking, anything like that. And then we get an MRI and it shows that there's a tear in the medial meniscus, so on the inside of the knee joint. Well, that's probably not contributing to the pain on the outside of their knee joint, but they have that meniscus tear, and that becomes important in our discussion with the patient on patient education because degenerative and damaged tissues are more likely to further degenerate or have damage and things like that because the integrity of the tissue is not there. And obviously the integrity is not there because that's a weak link in some form of myofascial chain or movement pattern or whatever it is. And so those things are important to discuss, but it's probably not causing or contributing to their lateral knee pain. Another example is in the low back. If we have a patient come in and they have some changes that suggest a tear in the disc, right? So MRI shows an annular tear, but this patient has no pain with any provocative movements for the disc. They do not have pain when they bend down forward, which will stress that posterior aspect of the disc or that tear. And they have pain when they go into extension or they stand really, really upright or lay on their stomach. Their pain is only on one side, whereas the tear in the disc is, let's say, midline. In those situations, we go, okay, you have this change, and that change is really important to us to discuss, but if your physical exam supports the diagnosis of facet syndrome or facet osteoarthritis, where the facet joints are actually contributing to pain, then it's not so much that that image finding of the tear in the disc is problematic and it might be something else. Now, again, it's important to take that information in the larger context of everything, but we also have to make sure that we are not just immediately linking that structural change to what might be causing patients' pain.